My name is Keith Choi. I work for the Johns Hopkins Education and Research Center for Occupational Safety and Health. And we're partnering with the George Washington University Museum and the Textile Museum in offering this webinar series for what it looks like a really underserved topic. We've had a lot of interest in this, and we have over 400 people registered for this webinar today. So hopefully they can all make it. I am the senior program coordinator for the continuing education program, and we offer limited series and also educational series on various occupational health topics. And I'm very pleased to partner with Maria Fusco and her associates, and I'm going to turn it over to her.
Hi, Keith. Thank you so much. And thank you everyone for joining us today. We really developed this program with the concept of partnerships in mind because the efforts and the progress we've made in kind of increasing our safety the progress was made via partnerships. It was some chutzpah on our own, but then mostly we needed a lot of advice and buy-in and guidance. So really everything was done by the village. So we've got some of our villagers here today presenting along with us. And so I'll just go ahead and get started. We're gonna do 2 presentations and then we'll have a Q&A afterwards. And we'll share a little more detail on that now. So let me get my presentation going. Okay, hopefully you guys can see not my note screen, but my presentation screen. So Lauren and I are gonna kick things off. So just welcome everybody. We're very, very grateful for the amount of interest and for everyone attending and for each one of you joining us today. And those of us who are in time zones, which you're sleeping right now, I'm glad you can join us by a recording later, or at least view this. My name is Maria Fusco.
And I'm Lauren Holt.
And we're the chief conservator and the registrar, respectively, at the Textile Museum in Washington, D.C. in the U.S. We're now known as the George Washington University Museum and the Textile Museum. We'll explain that more in a moment. Our partners in this series are Chris Spicer and Keith Choi, Keith, who you just met, from the Johns Hopkins University Education and Research Center for Occupational Safety and Health. The series was inspired by our museum's efforts to identify and reduce pesticide-related risk in our collections, and the path we took both to respond to our safety issues and to develop the series required input and guidance from colleagues in tribal, museum, and health and safety communities. And indeed, we've made efforts to invite people from each of these communities to this presentation series to further connect us to each other. Anyone looking to build a safer practice will equally not find all the answers in one source or one resource. You'll need a complex of partnerships from a mix of disciplines and backgrounds. And the goal of this series is to present a number of case studies of groups who've used partnerships to move towards safer practice. Every month through December, a different group will present on how they have built safer practice for their community or how they've supported others to do so. And these are the presentations from August through December.
Today, Maria and I will present on our efforts to build a pesticide safety program relevant to our collections. Our GW colleague, David Goldsmith, a professor and epidemiologist, will present on his view of these same risks from an occupational health perspective. At the end, we'll have a Q&A session where we will be joined by 2 industrial hygienists who have supported our efforts, Colleen McCaffrey with the state of Virginia and Nancy Nash of the Occupational Safety and Health Administration, OSHA, a U.S. federal entity. As a note, we do cover a lot of information in these presentations, so don't worry if you miss any details. We will be recording them and they will be available on both the Johns Hopkins ERC site and a little later on our museum's website, and we will email out notices once those post. We'll begin today with some background and highlight key collaborations which were critical to our progress. We'll spend most of our time covering details of our response phase, where we tested collections and work surfaces and implemented a system of safety controls. Then we'll cover our maintenance phase, which involved developing written guidelines and using them for ongoing training. Finally, we'll wrap up with suggested resources that would have saved us time and effort. But first, some context. Both the Textile Museum and George Washington University began as independent private institutions. GW was founded in 1821 and has been collecting art ever since. The Textile Museum, which first opened in 1925, was an early leader in U.S. textile conservation. In 2011, the Textile Museum formed a partnership with GW that found us moving locations and becoming part of the university. And relevant to today's topic, we began exploring the existence of collection safety hazards in 2022, specifically pesticide contamination from historic pest treatments. In addition to the Textile Museum collection, the GW Museum and Textile Museum is also home to two additional collections. The first is a paper-based collection of prints and maps related to the history of the District of Columbia called the Washingtoniana Collection. And the second is a collection of textile fragments called the Coatson Textile Traces Study Collection. The Textile Museum collection is made up of rugs, ethnographic, and archaeological textiles, mainly sourced from South America and Asia, with smaller representations from Africa, Eastern Europe, and in contemporary fiber art.
So why do we need to consider pesticides at all? Museums and collectors modeled the agricultural industry in the 19th and into the 20th centuries to preserve collections from pest damage, especially textile and natural history collections, though sometimes other mediums as well. Two distinct chemical classes were used in these efforts: inorganic pesticides and later organic pesticides, and more on those in a moment. Here at the TM, we have documentation of organic pesticide application to the original building and to the TM collection. Former staff consulted with U.S. federal resources such as the Department of Agriculture, following their advice in earlier periods. Testing indicates objects may have been treated with inorganic pesticides prior to coming to our museum. So what do we mean by inorganic and organic chemical classes of pesticides? The early inorganic pesticides are often compounds of heavy metals such as arsenic, mercury, or lead, though there are others. Sometimes heavy metals present from maker practices as well. There is expanded use of portable X-ray fluorescence spectroscopy, or XRF, to directly test objects for elements of inorganic compounds. The organic class is largely the byproduct of early 20th century chemical research and development. Numerous compounds fall in this category. Directly testing objects for organic residues is trickier and generally requires more complex instruments than the XRF, often mass spectrometry. Pesticide applications can leave residues on art historical objects were applied, leading to short-term physical reactions. But in the long term, exposures which are not mitigated by safety controls can lead to illness. If you're at a museum, creating an institutional pesticide use history can provide clues as to possible chemicals present. These are dependent on what past staff wrote down, which is often spotty and does not document treatments prior to accession, and these objects have long histories. Such text-based research is a good starting point, but only gives a partial picture. In our case, information comes from early board meeting minutes and in later periods, conservation reports. Our museum began with chemical approaches and moved to biological ones. Fumigation, as they called it at the beginning, began sometime prior to 1948. Pesticides were applied to building interiors, baseboards, and shelves, and directly or in proximity to collections objects. So far, 1 inorganic pesticide is documented, a silicofluoride, and 5 organics. In 1988, preventive freezing replaced chemical pest control at our museum. Anoxia was added in 2017. After acquiring an XRF, we began our investigations into pesticide residues in late 2022. And we can now build an institutional pesticide use history as our conservation department's historic records are being organized into a formal archive.
As we began to explore risk in our collections, collaborations were important at each stage of the process. The details of testing and developing a safety plan will vary between museums or communities based on a number of variables, but the collaborations needed are more universal. I want to highlight here the 2 types of occupational, environmental, health, and safety professionals we worked with. In building our program, we've worked primarily with certified industrial hygienists, and in later stages are realizing how working with epidemiologists in addition can round out the picture. We are a US-based institution, so these resources are, of course, local to us. However, we hope to make the point that while the specifics may not be fully transferable, the types of organizations are more universal. And we'd hope that there are similar entities in other regions and countries at the equivalent local, regional, and national levels. We are also particularly curious about the potential applicability for tribal communities. Industrial hygienists and epidemiologists are two types of occupational environmental health and safety, or OEHS, professionals. They each get specialized degrees. They may be employed at universities, as faculty or in safety departments, in governmental bodies, and are sometimes in private consultancies. Industrial hygienists' main functions intersect with our tribal and museum communities' needs, as they are trained to detect hazards, communicate about them effectively, and form holistic approaches to their mitigation. In the US, there have been efforts by the American Industrial Hygienists Association, or AIHA, to educate their members on the concerns of museum professionals. Epidemiologists have training on the biological impact of hazards. They collect and analyze data and look at big picture patterns and trends to determine causality. Communicating, guiding, and educating on risk are also some of their main focuses. They can each help us understand the risks we face and how to share this information effectively. You will often need to partner with a mix of professionals to get the guidance and answers you need. There may be local, regional, and national regulations you need to be aware of, which requires speaking with multiple sources and considering both chemistry and biology. A collections representative, an industrial hygienist, and an epidemiologist could create a most effective trio. Partnering within our museum was also key. Communications and leadership colleagues joined us in monthly working group sessions where they could leverage contacts and resources to aid us. Our assistant director's contacts led us to our state's OEHS partners, for instance. Our communications manager helped us streamline language and make guidelines digestible and effective. We also needed to look beyond the collection that we primarily exhibit, our textile museum collection, to other companion collections at the museum, the education and the traces study collections, especially as these objects are often from similar donation sources. We also wanted to examine the Arthur D. Jenkins Library's rare book collection, given research into hazardous book bindings. We needed buy-in and input from the staff of these collections, and especially regarding their needs for researcher and visitor access to the collections. We made the best decisions as a group, not as individuals.
Now we'll get into the details of our testing. This is an overview of the time it took us to get through enough testing to inform the development of a safety plan. We did not need to test the majority of our collection to begin developing our safety plan, though we have tested our work sites and work surfaces fairly exhaustively. It took us 2 years to get from initial detection and response into a maintenance phase. There were important philosophies we developed that helped focus our efforts. Number one, when you start to get data about hazards in your collection, it's tempting to act immediately and mimic protective measures seen elsewhere. We waited to make procedural changes until we had tested our site so we could base cleaning and PPE usage on what we were specifically finding. Number two, in our experience, you need to know some data to inform your response, but at a point, more data is not likely to give you a different result, at least in our experience. At our staff size, we would never be able to directly test the entire collection, and we can only directly test for inorganic contaminants with instruments currently in-house. However, we were able to test surfaces in contact with objects for both chemical classes. The surface testing data was perhaps even more important, what may be detaching from objects onto hands, skin, etc. Our third point, our OEHS partners gave us access to their industry's standardized vocabulary, document templates, and overall approaches. They also gave us perspective and focus and helped us not to obsess over quantitative detection in our case, but operate in presence-absence modalities, taking action if anything is detected. They educated us on whether detected chemicals were absorption, ingestion, or inhalation risks, which helped us focus our protective measures. Long before our more sustained efforts began, we made some attempts to mimic work being done at the Smithsonian's Museum Conservation Institute. Direct testing of collection objects for volatiles indicated use of organic pesticides. We partnered with a GW chemistry lab to access equipment and experience. We had promising early results, but the project faltered due to doctoral graduations, COVID, and the retirement of the lab head. While we're at a university, there are practical limitations with finding the right partner at the right time. More sustained testing began late 2022. As our conservation research fellow, Callie German, pictured at the top, onboarded our portable XRF. Staff conservators continue to build the data set after this. We do all this direct collections testing ourselves in-house, and this data set builds with each new exhibit we prepare. In early 2022, though, this gave us data to bring to GW's Environmental Health and Safety Department, hereafter referred to as EHS. A couple aspects to note here: as we do all our direct testing in-house, our small staff size and the lack of a conservation science department means this is a slow process, and there are limits to the number of objects we have time to test. Also, we are getting qualitative data, so confirmation of the presence of arsenic, mercury, lead, not quantitative. We have not explored developing standards for these heavy metals. With EHS's guidance, we expanded direct testing for inorganics to our education collection and portions of our library collection, focusing on our rare book collection and anything in the library's circulating collection from the 19th to earliest 20th century. Later, we subdivided these collections based on the test results. EHS and the Poison Book Project educated us on the importance of indirect testing. Direct testing of the collections was important, but testing what chemical components are mobile was just as, and perhaps in a sense, more important. Also, in terms of scope, with indirect testing, the number of surfaces to test is a more achievable count than testing the majority of a 22,000 object collection. EHS is a small department themselves and was not able to perform surface sampling, but they could provide expertise to arrange and supervise testing and interpret the report completed by an external lab. We worked with EHS to first undertake hazard assessment and identification, which is what you see on the left. We worked with EHS to next list our areas of concern in one document, which was this hazard assessment and ID form. And then we based our sampling plan on this. We also created a log on the testing day. On the testing day, EHS supervised the lab tech visit and later interpreted the analytical report. We found that residues were migrating from collections work tables to secondary surfaces, so this was a good wake-up call, though not a reason to panic. We found no migration of mercury or lead, which had been found through direct testing on objects. We did find barely detectable levels of arsenic, what our safety partners termed as trace levels, right at the limit of instrumental detection and far below an action level. With arsenic, we plan to operate in a presence-absence modality, acting when anything is detected, no matter its relation to action limits. Arsenic standards do not exist in the US quite in the same relatable manner as lead standards do. We also tested for airborne hazards. We picked a mix of inorganic and organic pesticides to start, with staff wearing monitors while they went about their normal collections care activities for several hours. Fortunately, nothing was detected in anyone's breathing space. We plan to test our second location, our downtown gallery site. This time, EHS did the swipe testing themselves and then sent the collected samples off for analysis at a new lab. This saved us a little money. 30 surfaces were tested for mercury, arsenic, and lead. At this site, only trace amounts of lead were detected in 4 collections-oriented spaces. For lead, we have standards to compare to. The levels we found were barely above the detectable limit and well below the actionable limit, which is 10 micrograms for floors and 100 micrograms for windowsills. We also retested the collection center in this testing round. Between the first and second testing rounds, EHS educated us on safety controls, and we had implemented them. 11 surfaces that previously tested positive for arsenic contamination in June now tested negative in December. This indicated our new cleaning programs, improved PPE usage, and glove hygiene were effective when consistently employed. We had to pay for our first 2 testing rounds, but our museum's assistant director had contacts in the U.S. Department of Labor, who led us to a free and very comprehensive resource. We learned about a non-regulatory arm of OSHA, the On-Site Consultation Program, which is administered at the state level in the U.S. and is free. OSHA's on-site consultation programs operate separately from regulatory or infraction-giving departments and assist small businesses with less than 250 on-site employees. One can request consultations at no charge, though one must agree to mitigate any safety issues discovered. Through the directory on the right, I was able to identify 55 agencies covering each U.S. state and territory. While this is a US-specific resource, we hope there are equivalents in other countries as well, and indeed we are curious about their availability to tribal communities. Though GW is a large entity, our museum only has 33 staff, which qualified us as a small enough business. It's worth noting that one should not shy away from reaching out to these state resources. In our experience, they seem eager to assist, and more groups qualify than you might think. Our collection center is in the state of Virginia, and we receive free guidance, a site review, and free surface testing from Virginia Occupational Safety and Health, or VOSH. This time, we were able to test surfaces for organic pesticides to complement the testing for inorganics EHS had facilitated. With this, we had a more complete surface testing profile. VOSH also provided information on federal and state exposure limits and shared industry standard procedural templates. They pointed us to OSHA Online guidelines and tools, which helped us write out safety plans. We will share relevant links toward the end of our talk, but the OSHA online resources are plentiful. There are guides which take you step by step through hazard identification, how to mitigate risk with safety controls, and how to develop, implement, and test a hazard control plan. There is a tools section with worksheets and templates to simplify these processes. More on this later, but the information we found here can be universally applied, not just in the US. Prior to the surface testing, VOSH toured our collection center to assist in identifying hazards. They provided us with a full assessment report, and luckily only minor recommendations were made. This provided reassurance as they were impressed with the controls they had put in place. In one visit, we had both a state and federal review of our practices.
Our next stage was an important step forward, using our testing data to inform our response. This was greatly informed by the education we received from our health and safety partners on a very important industry method, systematic safety controls. This education was key as it allowed us to be organized and methodical. We were following a well-established system and not creating an approach from scratch. More specifically, this method is visualized as a hierarchy of controls. This is a step-by-step approach to eliminate or reduce workplace hazards. These safeguards are ranked from most to least effective. You begin at the top and work your way down. In many industrial settings, one begins with the most effective controls of entirely removing the hazard from the workplace or substituting in a less toxic chemical. But we can't do that with historical collections. So what is left to us are the three lower controls: engineering, administrative, and PPE controls. We started with engineering controls. These isolate or minimize exposure to hazards by using physical barriers or equipment to prevent contact. We already had some helpful systems like our Niederman exhaust trunks, which provide local exhaust ventilation. Initially installed for solvent use, we began using them when examining or treating objects. Additionally, our HVAC systems were already designed to create positive air pressure in several of our collections rooms, pushing air out towards the exits and increasing ventilation. We are also exploring the installation of new equipment, including a sink in the hallway near our collections rooms, to prevent hand washing after glove use in our common spaces like bathrooms and the kitchen. We formalized and expanded our cleaning protocols as well. Work surfaces had long been cleaned with an isopropyl alcohol and water mixture, and this was confirmed to be effective based on surface testing. Frequent and routine cleaning was expanded to cart and shelf surfaces, computer keyboards, door handles, and bathroom surfaces, break room surfaces using alcohol wipes for electronics, handles, and doorknobs. We cleaned work tables before and after each exam, treatment, or rehousing session. We also cleaned shared computer keyboards before and after each use. We cleaned compact storage buttons, ladder handles, and cart surfaces after pulling objects from collection storage cabinets. We clean door handles into collections rooms 2 to 3 times per day, aided by tracking logs, which you'll see in a moment. Plans were made to annually clean shelving in the library and study collection center, and to more frequently clean cabinet handles and surfaces in our education gallery. Some of these tasks we can manage in-house with our staff. For larger jobs, though, such as the annual shelf cleaning, we plan to hire contract help to undertake this given the scope. To make it easy for staff to implement these controls, we made sure stockpiles of PPE were placed strategically, not just in the lab, but also in secondary locations. Laundry collection bins were placed in accessible locations, so lab coats could be laundered frequently. Lab coats were labeled for their home location, so they made it back post-laundering. We divvy up the post-laundry lab coat folding and putting away. As we all know, this is the part of laundry that can get very onerous, to ensure lab coats are always available where they are needed and stockpiles are always high. Stockpiles of cleaning materials are placed strategically at entry doors and by shared computers. This reduces the need to go locate them and serves as a visual reminder to observe the protocols. We acquired equipment to isolate laptops, which move across multiple rooms and work surfaces, to keep personal items away from exposed surfaces, and to more systematically regulate what surfaces objects were placed on. We no longer place laptops on work or treatment tables, but bring them nearby on mobile lecterns. We better train staff on what surfaces objects can be placed on and what surfaces are strictly for documentation materials and electronics. We acquired small mobile carts to place personal water bottles on outside collections room doors, but off the floor to keep them isolated from contaminants. This all took some getting used to, but over time it has increasingly become muscle memory. Next, administrative controls change the way work is done or give workers more information by providing relevant procedures, training, or warnings. In our education collection, we were able to initially eliminate and substitute items by culling the collection of little-use objects prior to testing. Through discussions with our education staff and EHS colleagues, we arrived at a practical approach that balanced safety and access. Listening to everyone's needs when it comes to collections access is very important. The education collection was eventually subdivided into 3 categories. First, items were disposed of that were not commonly used. Second, items with no presence of heavy metals can be used by visitors without any supervision. And third, items that did show the presence of heavy metals can only be handled by visitors over the age of 18 under staff or docent supervision, with the advisement that visitors wash their hands after handling. Signage was posted to retain segregation of these objects and where to go for questions. Training was also provided, which we'll get into in a moment. As another form of administrative control, reminders were built into the landscape. Labels were attached to shared desktop computer stations and break room tables, reminding when and how to clean and what materials were restricted in proximity. Graphics on magnets were attached to the interior of doors to remind one to remove their gloves. Cleaning logs were attached to the exterior of collections holding room doors to prompt and mechanize frequent cleaning of common touch surfaces. These logs are simply laminated paper with dry erase markers. Another administrative control that we implemented was to physically label objects. This label is intentionally generic, so it is evergreen and consistently directs one to consult the collections database. We are working on inputting this information into our database, including the hazard, if it's known, and the date it was tested. We want the process to be approachable and simple to implement. To maintain consistency of information, we feel that this system keeps our hazard information in one place rather than scattered on individual objects. This information is then also searchable in our database. Lastly, we also have another version of the sticker for when an object that has tested positive for a hazard is housed in a shared box with other objects. Initial and repeat training is another key administrative control. Training of docents and library staff has taken place. All staff, including students and contractors who work with collections, will be trained in the health and safety plan when they begin their positions. Periodic group refreshers will also commence. PPE donning and doffing training has been provided by EHS. PPE usage became mandatory once test results were received, and we reviewed the PPE options available to ensure that they were effective with the contaminants we were specifically seeing in the test results. 2 tiers of PPE were developed. First, our standard everyday level 1 tier. We use nitrile gloves and lab coats when handling collections materials, even while in their storage wrapping or box. Respiratory testing did not indicate wearing respirators was necessary daily. Second, our level 2 tier is implemented when handling objects that have elicited prior dermal reactions. This requires donning a Tyvek suit rather than a lab coat, wearing nitrile gloves, and using an N95 mask. We wanted to make a point here on how achievable safety improvements can be. Some of our larger expenses here on the left were later eliminated by free state services, or these might be improvements others would not need to make. The bulk of our ongoing expenses are relatively affordable, the smaller expenses here on the right. Knowing this and knowing the categories where you might need to spend can aid in developing budgets, especially for fundraising purposes, if you can demonstrate what are one-time or infrequent costs and what are ongoing costs. GWEHS recommended that we develop a health and safety plan to move us from a response phase and into a maintenance phase. If any of your institutions have a chemical hygiene plan, this is a type of health and safety plan, or HASP as we'll refer to it. While we already had object handling and space use guidelines, putting them all into one comprehensive document makes things much more efficient. We also included non-chemical safety matters like ladder safety. Then we can use this document as our basis for initial and annual training. Throughout the creation of the document, we assumed that everything has the potential for contamination and worked from that mindset. All sections of our HASP document point to other sections, appendices, and external documents for more information. The HASP is just the central starting place. So I'll briefly walk through the sections of our HASP to share what we've included, though your institutions might have very different sections. Our first section is a brief introduction detailing a background and history of how this document came to be. We also discuss here our commitment to working with GWEHS and to review these plans along with training for staff. It also establishes the requirement that all new staff will be trained on this material and that we will hold an annual refresher training as well. Our next section covers workplace operations. In the section on physical hazard control, we provide guidance on the safe use of ladders, blades, power tools, and how to safely transport objects. In addition to physical hazards, we also cover chemical ones. This section details lab safety and outlines the necessary trainings. Here we also provide background on the museum's pesticide history and risks, while pointing to other relevant documents on training, like our object handling and space use procedures, which are found in our appendices A and B. The next section details the background of our education collection, how it came to be, how we started to test it and divided it into the two subgroups based on the results, and how to manage the collection, with more information provided in Appendix C. As we mentioned before, the group that tested negative can freely be handled by visitors without supervision, while the second group is only available for handling by visitors over the age of 18 under supervision by staff, with hand washing strongly encouraged after. Next, we discuss our library collection and what it contains. We have documented here how the books were tested, provide handling and access guidelines that are informed by the testing results, and point to fuller details and training documents in Appendix D of this document. We also wanted to include what to do in the event of an incident and how to respond if there are dermal, respiratory, or neural reactions. This section provides step-by-step instructions on who to inform, including links to the university's risk management submission form. Next, our HASP outlines the technical report that Maria has compiled. This documents in great detail the past 2 years' worth of efforts to develop our safety program. It has a timeline of all the events and actions undertaken by staff that we've covered in this presentation, and the full document is available in Appendix E. Up next, we have a section on occupational health and medical evaluation. Here we outline that all collections-oriented staff must complete OSHA's Appendix D, shown here in the upper right, and receive medical evaluation before being fit tested for a respirator. And in our document, the OSHA Appendix D for voluntary respirator use is actually found in full in our Appendix F of the HASP. Confusing? Only a little bit. We are still developing our section on education and training. We want to include what staff from which department need training, when the training will occur, how the training will be delivered, and who will conduct it. We also wanted our HASP to include information on our museum's emergency preparedness and response document. The table of contents is seen here on the right. This document outlines our responses to a variety of emergencies like fire, flood, and damage to an object. This section of the HASP also directs users to where they can find the emergency response plan. Lastly, we end our HASP with a section on program evaluation and improvement. Our aim is to meet annually with all staff who utilize the plan to ensure that we aren't missing anything that needs to be added and update or improve areas where our documentation or details are not robust enough. To measure success, we didn't want to look to the number of incidents per year. Instead, we wanted to look at the input we get from staff on this and how successful we are at identifying and controlling the risks we encounter. We've had many groups review our HASP, including our colleagues in EHS and our VOSH consultant. Now in our maintenance phase, our focus is training. When we started testing collections, we had PPE refreshers and Q&A sessions with EHS. These had some success, but in large group settings, people are sometimes reluctant to express concerns. With a health and safety plan in place, we can plan, formalize, and repeat training on a regular basis. The chief conservator trains all new staff on the draft TASP, and once its final sections are approved, we will train on and review the whole plan annually.
Now to wrap things up with helpful resources. A note before I begin, we plan to make these slides, these next slides available afterwards to this session's attendees, so you can get the URLs. So no need to scribble furiously. We're also developing a section of our museum's website to share some of our safety program information in digestible formats. And once these resources are available, we will email you guys a notice and the link. Building a safety practice may seem overwhelming, but it is achievable. We got all this done with a combination of hustle, networking, and just biting off one small bit at a time. No matter your community or museum size, there are partners out there. This process was quite an education for us. If we could travel back in time, we would have done a few things differently, so we wanted to share them here. First thing we might have done would be to approach the OSHA and Virginia State free consultation services much sooner, pairing them with our GW EHS consultations. This would have saved us testing expense and sped our planning and procedure development. We recommend exploring this resource to all our U.S. colleagues, and would love to know if similar consultation services are available in other countries. Next, we would have also reached out to a nonprofit group called Safety for Nonprofits. They're a volunteer group in the U.S. who do not perform testing themselves, but they can advise on how to find testing labs and assess and address risk. They're a bit more safety than health-oriented, but they do have industrial hygienists in their group and have an interest in tribal community and museum engagement. In reality, you need several partners to move a safety program forward. I want to highlight too a promising endeavor one of our October presenters is formulating to develop partnerships in the private sector to supply these same testing and consultation services. This would be very effective for groups who don't qualify for free services or for people who need dedicated attention in a certain time frame. It's a very exciting effort, and we encourage you to listen out for it. A final note, we are considering ways our safety program development may be adaptable to other groups, for other museums, and for tribal communities, and we'll have a lot more to share on this in the future. Beyond developing a safety plan, there are activities which would help you on an ongoing basis. We'd recommend becoming a member of relevant working groups and online communities. Here are two on the left that are US-based, though do seem to have international members as well. AIHA's Museum-Focused Working Group and the Contamination and Pesticides Repatriation Working Group. There's also the Media-Specific Bibliotoxicology Working Group. Also look to OEHS industry groups. Local universities to you may have EHS departments or faculty willing to collaborate or offer advice. In the US, there is a network of education resource centers which support safety training, like our partners at Johns Hopkins. Unfortunately, many of these ERCs are facing funding reductions with recent US federal changes, but we encourage you to support them, reach out to them when and where you can. ISEE is a professional group for epidemiologists, and there are regional environmental and toxicology conferences to look out for as well. You can also build your knowledge base with a number of online or print resources. A good place to start are the FAIC Connecting Collections Care webinars. The second series will be available online in 2026. The Poison Book Project's webpage is a trove of helpful information. While it focuses on books, their approaches and philosophies are universally educational. The Hazardous Heritage Conference, which was held in Europe, now has its very educational postprints available online. The Smithsonian's 2010 Pesticide Mitigation Workshop postprints are helpful as well, as is the 2005 Old Poisons and New Problems. Marilyn Poole's pesticide database on museumpest.net is very thorough and an incredible resource. US OSHA's website has very helpful guides. The safety approaches shared there are mostly about process, not specific to US regulations, so they're universally useful. In developing safety plans, they were our most effective online resource, and I highly recommend checking them out. Museum-oriented professional groups increasingly have safety-oriented subgroups who are developing content. David will show more on this last resource based at a university in the US, the National Pesticide Information Center. They have a very responsive advice line now with a live chat feature. They helped me begin my safety research back in 2014. The external working groups I joined led to someone who is now a colleague, David Goldsmith, an epidemiologist in GW School of Public Health. 20 years ago, he was the project PI for the Tribal Medicine Project, and he taught a course at GW on health and safety in museums, which he's trying to redevelop. David advises us on personnel safety and shows us the vital role epidemiologists can have in our safety efforts. He also led me to the Johns Hopkins ERC. So Lauren and I will say thank you for listening and hand things over to David.
Thank you, Maria, very much. I need to talk about sharing my own slides, and I think I just need to click on this. Let's see if I can manage that. We got the end. Let's see if we can get to the beginning. Can you all see this? Maria, can folks see this?
Yes.
Okay. It sounds like what I need to do is click on slideshow from the beginning. Okay. Before I start talking, I must say a couple of strong words, positive words. First, to thank Maria for looping me and the School of Public Health into her initiatives on staff health and safety. And the second is to thank our colleagues at Johns Hopkins for hosting this. I have a longstanding positive interaction with colleagues from Johns Hopkins University, and I am very pleased to work with you guys on putting together a presentation this afternoon looking at more on pesticides and health risks, and wanted to thank you directly for your efforts. Again, I would like to recommend, if you have any questions, please put them in the chat. We will try and get to them. Hopefully there will be enough time at the end for questions. So let's see if we can get this to go forward. Okay. I want to introduce the occupational health community to the needs of folks in museums and who are also art conservators. My focus is going to be on pesticides, something that Maria and Lauren touched on, but I want to look at that in more detail because it brings us into a stronger focus on Native American concerns, and we will talk about that in a little bit. But I also want to say that we need to discuss where we have this overlap or crossover between what's going on the public health side and epidemiology side, and what the needs are for people who are managing museums, who have to do as Maria does to control and to provide guidance for her staff related to safety and health. And I'm hoping at the end we may have a little bit more that we can share in this regard. So, a little bit more here. Museum managers have the responsibility for the objects that they display, and as Maria has demonstrated so clearly, the health of the different communities who interact with these objects, what I have called shared prevention ethic. And Maria has taken it upon herself to focus really critically on her staff and what's going on in her working spaces is something that should be adopted all over the world, frankly. But I want people also to think more broadly than that. I want you to think about volunteers who may work with you at your museum, or the public who may simply come to hear or to be involved or to take in your exhibits. So that means putting it really simply, stretching your awareness of what these public health issues are and what museum conservatives and employees must address themselves to. And she mentioned several of these professionals. I just wanted to list them really briefly. Industrial hygienist is high amongst that group, but also includes toxicologists, occupational health practitioners like nurses and physicians, epidemiologists, and other medical experts. And what we know is that if you are seeking information about training and sources, I want to tell you about the American Industrial Hygiene Association. Maria has mentioned the Occupational Safety and Health Administration, OSHA, NIOSH, the National Institute for Occupational Safety and Health, the education and research centers, which are located at major universities in the US. And she also mentioned the pesticide health centers. We'll talk about that a little bit more. And in certain states, there is a pesticide occupational health program. And most specifically, I want to bring it to your attention what's going on in California. A little bit more about introduction. We really are going to look at the museum settings where pesticide exposures are the primary concern. We're going to talk about the regulatory and industrial hygiene settings and where we need to get a blend of leadership in terms of management of these collections and the health and safety side. And I'm also going to briefly talk about some illnesses that have been linked with pesticide exposures. And from that context, you can also see there might be the possibility of doing some research collaborations with and for museum professionals. And I would just like to add that what we're talking about in the US is also of interest and of concern outside the US in places like Canada, Australia, New Zealand, in the European Union, and in many other places. And as I say at the bottom, I would like those who are on this session today become advocates for workplace prevention and furthermore, historians for museum workers. Okay. So do you all know what NAGPRA is? And my guess is for those folks outside the United States, the answer is no. The NAGPRA stands for something called the Native American Graves Protection and Repatriation Act. It came into law in the United States in 1990, and it was authored by Senator Inouye from Hawaii. And Senator Inouye and his colleagues passed this law, and basically it says that if you as an institution have some Native American remains or funerary objects or sacred objects, you need to communicate with the tribes and organizations who either supplied them or now are in a position to receive them back from your collections. And here is a couple of bits of data. This is somewhat out of date, as you can tell, but as of 2024, the Bureau of Indian Affairs had repatriated over 2,600 human remains and over 35,000 funerary objects to the tribes, communities, and the descendants. As of 2021, the Smithsonian Institution here in Washington, D.C. had repatriated the remains of over 7,000 individuals and 250,000 funerary objects and other objects. And what has happened under NAGPRA is that there is a laboratory-based assessment of what the toxic materials are, what the pesticides that are on these cultural artifacts and how much of a risk there is. And we'll talk more or less in the rest of our hour or of our presentation about that. So what are some of the pests that are linked with these, what I'm calling Native American cultural objects? They include things like textiles, clothing, blankets, carpets, dolls, hides, headdresses, masks, including feathers, bones, fibers, bark, and wood. And these can be targeted by pests that will ultimately lead to their destruction if not preserved or prevented. And just to reiterate something that Maria told you, the objects today that are in collections today are frozen before they are evaluated and before they're put on display, so they don't have the use of these pesticide chemicals. Here are some lists of things that you should be aware of that are of threats to textile. They include things like moths, carpet beetles, silverfish, rodents, other insects, not to mention, of course, heat and humidity, as Washington, D.C. is baking and broiling this afternoon. And that, of course, can set up all kinds of risks for hazards to materials. And we're really trying to prevent that from taking place. So I just had a couple of examples I wanted to share with you. This is a Plains Indian beaded hide shirt. I don't exactly know where it's on display. Here's another one. No, sorry. These are from the Northwest communities, Northwestern tribes. These are wooden toys and masks. You can see in the two in the middle and on the left, they've already had some destruction where who knows exactly, termites, beetles, whatever, ate at the wood, and that's part of the reason why you can't see them all. But that is also the reason why we want to pay attention to see what was on them going forward. So here is a couple of examples about leather and fiber artifacts. I don't know precisely where they're from, but this is the kind of thing that is often found in museums and for which they have had pesticides put on them. So here are some of the common and what I'm calling older pesticides that are encountered when the repatriation process that is required under NAGPRA takes place. The first and the most common is arsenic trioxide, followed by mercury chloride, methyl bromide, DDT. In mothballs, and naphthalene is the broad chemical name there. In these 5 groups, you can see some approximate dates when it would have been clear that there would have been something put on these museum items to preserve them. What we want to be aware of is that there are acute effects that are related to working with these objects, often in confined spaces, and they include things like headaches, possibly rashes and neurological symptoms. And the rashes can be an issue when these objects are handled without wearing gloves. And I'm going to come back to that in a second. For chronic effects, we are concerned that mercury can have impacts on the central nervous systems. That is what CNS stands for, has effects on the kidney. It may have effects on in utero children, and arsenic, for example, we know is what's called a type 1 known human carcinogen based on the evaluation by the International Agency for Research on Cancer. It has an effect on the skin and the lungs. DDT is a probable carcinogen, and naphthalene is a possible carcinogen. Naphthalene is could be studied more thoroughly to see whether or not that whether there's evidence to upgrade that to suggest that it's more of a serious hazard than the use of what is called possible carcinogen. And again, Maria mentioned the National Pesticide Information Center. That's located at Oregon State University, has been supported by the EPA. With the cuts that has been leveled at the EPA, I don't know precisely how the NPIC is going, but I want you all to know, both for US and for overseas, it has a very good reputation, and I strongly recommend that you might put it into your search bar and see what you can. California has a strong program on pesticide illnesses that can provide a link with agricultural and industrial exposure. And this is a very useful thing if you're looking at more up-to-date pesticides that you may have concerns. This may not detect some of those earlier pesticides that I just mentioned so much, because they are really focused on what kinds of health problems and illnesses are linked with commonly used pesticide products in 2025 agriculture. There is a book published by the EPA, written by Roberts and Riegert. The last edition was published in 2013. My understanding is that there's a new edition coming out in 2025 called The Recognition and Management of Pesticide Poisonings, and it remains a very useful source for clinical information about pesticides. So in that context can be very helpful to physicians and nurses who may see patients with acute problems that may be related to exposure. And I want to also reiterate just what Maria said. There's something called museumpests.net, and I would strongly recommend that to you as well. So let's come back to the cultural heritage collections and things like that, and the potential for human health risk. And here I must introduce you to Dr. Nancy Odegaard from the Arizona State Museum. Dr. Odegaard has been way out in front of this issue. I believe she has been working on this question for at least 25 years, and she is a recognized expert in this whole thing. She has, and others have, indicated that there are many hazards linked to NAGPRA-related objects or to the persons who are handling them that involve what we call medical implications, and determinations cannot be made without testing and sampling the object or its surfaces. And Maria Fusco just went through in her talk the kinds of activities that she and her team supervises, and I strongly recommend that you go back and listen and hear what she is talking about in terms of taking samples from these objects. But it is important to look, even though you may not have the specific information about what chemicals are involved, try and gather what pesticides may have been used, and that you can gain from things like tags or labels or marks on specimens. Look and see if there's any residues or persistent odors, or if you have old containers that may have held the pesticides or preservatives that you're concerned with. To a certain extent, that this is somewhat of an awkward situation, because what you're trying to do is determine what pesticide hazard levels there might be, but without any specific details on what was used to preserve them. So again, reiterating some things, that the pesticide concern levels are really three. One is inhalation through breathing. Second is ingestion. Oftentimes you may have contamination of eating and drinking surfaces, and by extension, the possibility of containers that might have been in collections and then are sent back to the tribal communities and then used during ceremonies. Absorption talks about entrance of pesticides through the skin. And again, as you can well imagine, that can be a problem when handling or wearing certain items. Exposure can also occur where treated items have been cross-contaminated by contact between the clean side and the pesticide-containing side. And we also need to be aware about contamination of food and beverage in the same way. And we do want to reiterate something that she also mentioned, that there are at least 5 chemicals that are involved in pesticides: arsenic, mercury, lead, copper, and chrome. And they've all been used in many cases to use in these older preservative settings. And this is the kind of thing that you may need to test for going forward. So prevention is the best means of controlling these kinds of exposures. That means you need to recognize what they are. You need to identify the people who may be at risk. And as I said, Maria talked really about her staff, but let's not forget that you may have school children who come to see your collection and may handle them. You may have tribal children or adolescents who incorporate these returned artifacts in some cultural activities, dances, and the wearing of masks and so on. You need to try and get as much past history. You need to evaluate what the existing control measures might be, which ones are going to work and which ones are not going to work. And you need to determine how much of a risk there really is. And the risk really is a function of the severity of injury times the likelihood of danger from the exposure. And if anything is there, you want to record your findings and also make sure that they are recorded in a way that's in a language that's understandable by the community who's going to receive the artifacts on the way back. You need to also monitor health and identify prevention efforts. So, recommendations for handling potentially contaminated artifacts. Unless you can confirm that an object is safe, that it's never been treated with a pesticide, I would suggest that you handle all museum objects as though they were treated with some toxic compounds and use your professional judgment. That means try and work with toxicologists and epidemiologists and physicians and nurses to make sure you've got your advice as to how they could be used. This also means that until the risk is confirmed, it's not advisable to place objects in open or non-enclosed exhibit cases, to utilize objects on hands-on interpretation, or to wear or perform ceremonies with them, or to place the objects near food or other consumables. Number 3, it's recommended to examine potentially contaminated objects in a well-ventilated working, and I call laboratory environment, and thus it may be advisable to use a fume hood to examine these objects and avoid small rooms or closets that are not well ventilated. Again, all of the things that I'm talking about here are really strong common sense, but it bears repeating for those who are relatively new to these issues. Handling contaminated artifacts, you want to handle them with your hands as little as possible. Try and use the mounts or the storage containers rather than handling them directly. It's strongly recommended to use personal protective equipment, and I believe in many of the slides that Maria showed you, you had people wearing face masks, you had people wearing dual cartridge respirators or some sort of mouth covering. That's very advisable. She mentioned and she showed disposable gloves. That's exactly what we should be doing so that there's no skin contact. And the disposable N95 or dual face respirators, these are much better than simple cloth respirators that we used trying to keep ourselves from being exposed during COVID. We use a protective apron, smock, or lab coat, much better than having people walking in with street clothes. And lastly, eye goggles. Again, everybody who's on this call should know about how important all of these things are. Always dispose or care of the protective equipment after you use them. Don't reuse disposable items. Always wash your hands, especially before eating and drinking, and report and document any health irregularities like skin outbreaks or irritations around your face, other kinds of severe problems, because that may be related to handling contaminated objects. So I put in a little bit here about spot tests, which can give, if you will, a yes or no guideline with regards to the presence of pesticides. Again, wear your PPE, read the test kit or instructions prior to running the test, make sure you use fresh reagents, hold the test papers with tweezers, not with your hands, work in well-ventilated areas, make sure you have written notes in a lab book or something like that for what you're finding, and prepare for proper disposal of the test reagents and test materials. And there is also something that you can use as a backdrop. It's material safety data sheets, sometimes abbreviated MSDSs, and these are for all chemicals, including pesticides, including these older pesticide chemicals. I'm pretty certain that they are available any place, and certainly for those outside the US, I'm almost positive you can get all of these things online, and they have a lot of information that may be of relevance. So I've got a little bit here about a spectrometer and reading a spectrogram, and what you need to do is to get the sample, which is down here, where you've got these two arrows coming together, and it's read through this detector, and it shows up in terms of what the findings are, and that can be a very good help in addition to the spot testing that I just mentioned. Here is something for using the X-ray detections for toxic metals. I mentioned mercury, arsenic, copper, chromium, these residues. And here again, adopt the best practices, provide safety training for everybody in your lab, use calibration samples, and develop and use testing protocols so that everyone who is doing them knows how they work and what is required from a safety perspective. Develop medical risk calibrations and containment strategies, and make sure that you don't just analyze a lot of things, but give helpful written reports or have them preserved in some way. So care is needed in the return of Native American ceremonial items. These returned artifacts are liable to have major cultural or religious significance, and I have been lucky enough to see some of those where the Smithsonian has consulted with Native American tribes and their leaders in the returning process. And I do want to say something quite clear here. Regardless of what toxicity levels might have been found, or in some cases not found, the tribal recipients are the ones to decide their fate and their use. It's our job as public health leaders and public health role guiders, if I may say, to frame the risk. But keep in mind that children or adolescents, women and mothers to be may actually handle the artifacts if they're reintroduced into ceremonies that may be of vital interest to the tribal communities. But having said that, I do know that the Hopi community, one of the communities that received a lot of cultural artifacts, many are Kachina dolls, have had them returned to their ceremonies, but have not reintroduced them into Hopi activities, but they have had them stored, not displayed, at the Museum of Northern Arizona. And I was just visited a colleague from the Hopi community last year, and he reiterated that that is, for the moment, that is their tribal approach to this kind of thing, that they do not reuse or reintroduce these kinds of things because of a concern about pesticide residues. So thinking about museum hazard controls, and again, I want to thank you, Maria, for having shown us this. The hierarchy of controls, as you can see from this, which is a standard way of thinking about this that industrial hygienists do, is to eliminate or substitute and replace the hazards. But in returning these cultural artifacts, these two options are off the table. It's just not going to happen. So that means we've got to come down in terms of the controls to engineering controls, which is isolating people from the hazards, or administrative controls, changing the way people work with them. And then last is the use of personal protective equipment, which is, as you can see, the bottom, if you will, of the hierarchy. And in this context, we just need to be aware that that is the lowest place that we can consider preventing the potential for pesticides being a problem. So what next, and what are our conclusions? There are approximately 11,000 museums in the United States. They employ, as best I could guess, about 131,000. They earn a lot, $16 billion every year, and many of them have assets over $100 billion. And let me just say that what we're talking about is only in the United States. If we were to think about this globally, museums in Japan and Canada and in the UK and in France and in Italy particularly and in Egypt, that you could multiply this maybe by 10 or 100 times every place around. And there are clearly organizations like the Smithsonian, we've talked about that, the Museum of Modern Art, the Art Institute of Chicago, the National Gallery of Art in New York, the Getty Museum in Los Angeles, the Museum of Modern Art. These are places that earn a majority of revenues in the nonprofit museum world. But that is all good and fine and well, but there's still a need for more and better cross-disciplinary health and safety, especially focused, as I mentioned, on repatriation issues. ERCs and university public health programs can be active collaborators, and I would strongly recommend what we're trying to do both at GW and at Johns Hopkins to look for ways of finding areas of collaboration and training on this. And it's clear that more research is needed to make sure that we are doing what Maria is doing to understand what the health of her staff is, and to understand broader what the field might be. And in this context, I would very much like to have you join in our efforts. And for that, I want to thank everybody online. And as I said, particularly Maria Fusco and our colleagues at Johns Hopkins.
Thank you very much, David. As you can see, like, it does help to have different people from different backgrounds looking at the same issue. And that's kind of what we found to benefit us very much. So, you know, we hope it benefits you guys as well. And I wanted to make sure we had time to answer some questions too. Thank you all so much for adding some questions to the chat. And we'll dive into some of these questions. First, just wanted to give our colleagues, Colleen McCaffrey and Nancy Nash here. So Colleen was our partner at Vosh that helped us do the testing and came on site and everything. So just a big thanks to her. And Nancy is the one who led us to Colleen. So we have a lot to thank them for. It's all a long and winding road. But Colleen and Nancy, is there anything you guys want to add to what we said before we dive into the Q&A? Anything we missed on the resources? Or especially a lot of our attendees will be from outside the US. So do you know of any equivalents, Canada, Europe, anywhere, similar programs?
I think you've done a pretty thorough job. Thank you.
So Maria, you know, I saw that question come up, so I quickly kind of looked it up. And the Canadian Centre for Occupational Safety and Health and Safety, CCOHS, on their website, it's, you know, there are some questions and answers, and it says, does CCOHS offer occupational health and safety consulting services? And it clearly says no. However, they do have an information line, and it looks like, you know, anybody could submit a question. It sounds like they have professionals to answer those questions. So if there are people, you know, on your webinar from Canada, I highly recommend they look, you know, just maybe Google CCOHS, Canadian Centre for Occupational Health and Safety.
you, Nancy.
And then, if you don't mind, if I add, Maria, I did very little for Maria. They just did a phenomenal job with their program there, and I can't say enough about also North Carolina. But I just want to let everybody know that that consultation program is available in every state and territory in the United States. And I can't, again, it's no cost, and it's a phenomenal program. And when our consultants go out to the workplace, the employers routinely comment that they wish they would have known about the consultation program sooner.
Yeah, I agree with that because it was a very gentle process. I think there can be a lot of concern that you are exposing yourself to liability, exposing yourself to censure by reaching out to a state entity. That can be concerned, but we found the process to be gentle and supportive and not at all linked to infraction citations. And we were supported the whole process. Every time I talk to Colleen, she tells me, I am with you the rest of the way, anything you need. So I've got to think that's a big question that we want to resolve too is, are there similar resources in other countries? I feel like there've got to be somewhere because the US is, we don't have the best reputation for being the most safety-oriented culture. So, we're always the most supportive government. So I'm really so proud of us. We have these consultation programs. And I hope there's some equivalents in Europe or somewhere. So that's going to be a question I try to answer too. And to folks that have joined this seminar, if I find out those answers, I'm glad to share it with the email list. Glad to hear if any of you know of anything as well. But thank you, Colleen and Nancy. And I'm going to try to be the MC here. This is not my skill set, but try to clumsily go through some questions. Start at the beginning. First, there was a question of whether we're going to share PowerPoints from this presentation. We definitely are going to try to share in a couple of formats. So this has been recorded, and this presentation and all in the series will be available on the Hopkins website, their ERC website. And in our museum, we're building up a research section too. So we'll post this recording too, and some other resources. We're going to try to come up with a distilled down guide, like a 2 or 3 page document to share with people that is in essence the last couple of slides we shared on resources, but almost a workflow to not say we know everything, but this is what worked for us in this space, in this time with this collection, and to share other resources too. For the PowerPoints, we definitely already got permission to share part of them for our museum side. I'll see if we can share all of them, all of the slides. And David too, we can see to what degree we can share this, but that's a reasonable request.
Yeah,
So,
and can I add that with collaboration with Maria, we are trying to put together a class on museum, broadly based on museum health and safety that talk not only about these topics, but also things like emergency issues and electrical issues and safety and health from a very, very broad perspective. And I am trying to see if we can get permission from the powers that be to offer this class both in person and online starting in the winter of 2026. We are going to make every effort to try and put together a class that will address some of these issues. And we would be very happy to have suggestions from any of you in our audience, especially related to topics that are of concern where you are.
I'm going to drive on to the next question too. And when I'm reading your questions, if you guys want to unmute and chime in with more information, please feel free. Next question was from Melissa. How was the surface testing done to be able to provide quantitative data rather than just qualitative data for inorganics? So yes, for the indirect testing, those were basically the text came in, or our EHS came in with little square templates. I think they were 10 centimeters by 10 centimeters. So you had a standard area you were swabbing, alcohol wipes or some solvent on them, wiped within that square over a certain amount of time. Then those swipes were sealed, bagged, and sent off to the lab. So then we could get sort of a contamination amount per this square centimeter area. And that gave us quantitative data. For us, we felt that either qualitative or quantitative data were both useful, because we recognize not wanting to get mired down in obsession over, is this the action limit? Is this not? Regardless of the level, it was going to cause concern amongst staff. And so we wanted to act no matter what. And, but yeah, that is how we did the surface testing. Hopefully that is clear enough. And we covered, do you know if there's an equivalent program in Canada? Not that we were able to find, but I know that there's a lot of great work, much before the work we did in our museum. There's fantastic work being done that has been done in Canada and is being done. I know CCI is looking to educational resources on this topic as well. So I would definitely keep an eye on CCI's webpage at the Canadian Conservation Institute too, as they release information. So that's all I know about equivalent groups in terms of consultations in other countries. Are you aware, a question from AJ Salter, I think in the Netherlands, are you aware of the publishing from the National Library of the Netherlands about arsenic in book collections? Luckily, they also have so far concluded that there was no detectable health hazard for staff working with books that did test positive for arsenic. Yes, colleagues in Northern Europe are, I think, way ahead of, what Lauren and I are talking about for sure. And we've started to get educated on what's going on there, particularly in the Netherlands and Belgium, Germany. And our presenter in December, Danielle Mark, is from the Rijksmuseum, but is going to be presenting on the shared collection facility. And she has knowledge as well as some of the library projects as well. So I'm aware peripherally, but hopefully in the December presentation, we'll learn a little more as well. Next question from Alexandra. What XRF lab did you use for processing the data? Was this through your university? Did they charge? So for us, luckily, we were able through grant funding to purchase an XRF. I believe people can rent them from places as well. And then we trained from the manufacturer how to operate them and then spoke with colleagues to continue that education. So we operated the XRF in-house, our conservation department. We do the scans, we read the spectra. There were some questions too on, how you maintain these. We have to register ours with the state of Virginia, maintain that registration annually. Every couple of years, they come to inspect the device. And then we in our university had to take some safety training too on X-rays, basically X-ray safety. But these are expensive instruments. They're about $50,000 US, but I believe you can rent them, or, what is very promising is the private consultancy endeavor that Paulette Redding is trying to put forward, because, you can ideally collaborate with colleagues in private consultancies who maybe can access or have their own XRFs. That's another option as well. And so I'm hoping as more people are talking about this, the researchers will be more and more available. Let's see. Is one question from Mary Corrigan, is water consumption permitted in the areas, or is there another use for the water? In terms of personal water consumption, we don't bring them into lab or storage rooms. We have them outside those workspaces, just outside of the door. But we started to recognize they were being stored on the floor, and that has a potential for contamination. So we just got little cheap rolly carts and put the bottles now on those carts. So those were just personal for personal hydration, basically. Lauren, please interrupt me if I'm missing anything too. Joanne Hackett, a question. Was there an incident or series of incidents with staff that prompted this course of testing and response? Good question. So we moved over here from a historic location, and even at that site, occasionally curatorial or conservation or collections management staffs would have dermal reactions. Wasn't frequent, but did happen. So we were aware peripherally of this. Moved over to the university, and I had a reaction while I was pregnant when someone was working on something in a separate room, closed doors. But she and I both developed headaches and nausea. That's what kicked me off into looking into this. So, I mean, luckily my child is fine, but the NPIC, I called them and they were able to really educate me on biological implications, chemical implications. So that's kind of what kicked us off, though staff would have dermal reactions, neural reactions, sometimes periodically, and we weren't able to get much movement forward until we got the XRF and until we had a staff member who had the time to onboard it. That was a big key as well. Once we started getting data, we had something to point to bring to partners rather than just anecdotal information or narratives. So that data was really key for us.
So Maria, can I just jump in, and I do apologize, but it is important for us in this discussion to recognize the professionals in this field, broadly based, tend to be much more women than men. And a lot of what we are talking about is from male workers exposed to things like arsenic or pesticide applications and things like that. And it's incredibly important to try and understand the differences that women have to men with regards to their responses to some of these exposures. And I failed to include that in my talk, but I do think that's an essential epidemiological point that we need to keep really front and center in terms of prevention and health and safety issues.
Yeah, thank you, David. No, and it is a concern too of just pregnancy. I mean, that's another, and not knowing for the first few months, most of us don't know for a little while. So these are definite things to be cautious about and be aware of. Next question, AJ Salter mentioned works for a collections care, safety, and management company in the Netherlands. If anyone is ever looking for resources or help, I can help. So AJ, yeah, if you can let us know what that company name is, that is great, because a lot of times it does need to be a combination of public and private resources. So feel free to drop that in chat or unmute as well. What product do we use to clean the surfaces that the artifacts touch? Is it just isopropyl alcohol wipes? Do you worry that will damage the artifacts? So what we use on our tables is we have spray bottles, and we mix in there 50% water, 50% isopropyl alcohol. Sometimes it's just what we buy from like the drugstores. It's 70 or 90% concentration. And that's what we use. We clean the work surfaces. We make sure they dry, and thus the alcohol should have evaporated and the water will have dried. So we're not worrying about contaminating the objects. And that cleaning solution was proven effective for us, at least, in that the work surfaces we tested between June of one year and December of another, once we were employing those more regularly and in a systematic way, we weren't seeing the contamination we were seeing 6 months before. And the only thing that had changed was us making these safety measures much more systematic. Same collections, same people interacting with the collections, same pesticides on the collections. All that changed was our safety practice. And they were really simple things like cleaning the table before and after each session, watching glove hygiene, really simple and free, for the most part, activities. So one could almost, no, I wouldn't suggest this, but if you are not able to test collections or surfaces, simply implementing some of the safety procedures we have done could really put you in good stead until you can test, or even if you can't test near term. What was the process for acquiring and implementing XRF? Okay, so I think we covered this, hopefully. If we didn't, please speak up. Let's see. And yes, there is a Smithsonian, well, I think Smithsonian with other groups, with the Washington Conservation Guild, a safety summit in November of this year. It is in person, but they're accepting abstracts right now. The deadline is Friday for presentations. I've never attended before. It seems like a fantastic conference, and we're going to attend as well. But it's a safety summit that the Smithsonian and the Washington Conservation Guild and others are putting together as well. So that might as well have resources. Registration isn't quite open, but if you can get onto the Potomac AIHA mailing list, you will hear about it. And there's a link in the chat for that as well. And Selena has shared some really helpful resources as well. from a Native American perspective. I mean, we're speaking from a museum's perspective very much. What I really want to do is to see if anything we've built can be adaptable. And for that, I know Lauren and I need to increase our education as well. So I think in one of our slides, we wrote out listen, listen, listen. And I think that's the key. You know, we had to apply some of these skills in working with our education collections and study collections. Listen to what their needs were first, what their fears were, concerns were, and then go from there. But we would very much be glad if any of the work we've done could be adaptable to tribal communities. And that is one major area we'd like to explore. If anyone is interested in partnering, let me know. And then thank you for mentioning too that this book, Old Poisons, New Problems, new edition coming out this year, apparently. Super exciting. I have it right here by my desk because it is so helpful. So that's fantastic. And let's see, I know we're reaching past 2:30. If people have to jump off, please do. Oh, the IRRST in Quebec is also a good resource. Thank you, Michael. That's in the chat. And then I see, yes, more mention about the Safety Summit. And here's Kathy. Yes, she's, let's see, they're going to email some links on the Safety Summit as well. Let's see, are the lab coats washed in-house or sent out to a laundry service? We wash those in-house in our, we have laundry machines in our lab. So we try to be careful with the dirty ones, putting them in. We try to ask people to change them out daily, and we launder them constantly, it seems like, so that everyone has a supply of lab coats, and that's never a barrier, the lack of PPE. Here too, thank you, Paola. In Canada, some of the provincial and territorial worker safety boards provide information, and some are willing to work with individuals or museums. Yes, at the local level too, there are often resources. So it doesn't just have to be federal or province or state. Reach out to your local health authority as well. It's a lot of detective work sometimes, these programs, but it does pay off. Let's see. Yes, and then Anna here has mentioned the, within ICOM as well, a particularly focused working group. And there's a link to an email as well in the chat. Yes, let's see. It says here too, for XRFs, you can ask Bruker to borrow one free for a month. I would suggest, you know, striking a little deal with Bruker and seeing if they'd come out and test some things for you as well. We found not being shy, and it never hurts to ask for help, to be really a fruitful method for us as well. Wipe samples, check with an accredited lab. You can do, spectroscopy or, yes. So wipe samples are something we didn't talk a lot about, but one of our October presenters, just in how to do some of these tests in-house, learn how to use the swipes and test them off, send them off to a lab. You'd have to pay for this service, but it's another ERC collaboration project that will be talked about in our October session as well. And AJ, thank you. Helicon Collection Care is the Dutch company. Thank you very much. And Keith can email folks transcripts of this chat as well. And thank you, Mary. Yes, prudent avoidance is a good topic. And Selena, there are many Indigenous cultural heritage stewardship resources. Another question, do we get any pushback about wearing gloves, lab coats in your collection? Luckily, no. We had been kind of casually doing this, and it just became more of a formal process. Not any pushback at all. I think it was just hard to remember to do this, you know, and we had to kind of keep practicing it, so it became muscle memory. But luckily, no pushback from staff, from hires up. As far as I remember, hopefully I'm not misremembering anything, but our staff have been really, you put these programs in place, but they're really only successful if everyone employs them. So we really have to give props to our staff for maintaining them. That is the key.
I'll just add one very brief thing in adding lab coats. Obviously, in a collection space, you're moving around, you're moving things. It does get warm. We just bought some neck fans off of Amazon. They are a great investment. I think they're like $20 each, but they just help, making the lab coat a little more comfortable. So that might be a helpful thing to get if you're going to also use lab coats.
Thank you, Lauren. Yeah, those have helped a lot because once you got the gloves on and the lab coats, it's a lot. And Selena, thanks for sharing the email. I will definitely reach out. Thank you. Jill shares, I'm working at an Indigenous-led institution, and it is adaptable as each group approaches culturally significant materials differently. Yes. And that is what's key, is to kind of, I think, find out how people, what everyone's needs are, and start the conversation there before. It's very tempting just to dive right into testing of a response, but just slow down and start back at what does everyone know? What does everyone need? And I think, yeah, I mean, I can't necessarily answer, we can't answer these questions on whether our programs are adaptable. We would need to find partners to tell us, really, because we need an education on this too. See, and somebody was asking about the book. I think it was the Old Poisons, New Problems book, which another edition is coming out. And there's information on this, the authors in the slides I will send out as well. So you'll have that as well. Let's see. California State University system is also able to utilize some of the methods, as we are directly involved with NAGPRA and CalNAPRA. Happy to help coordinate as well. David Silva, thank you. And I know we're reaching time, and I may not be able to keep everyone on here that much longer, but Keith will be able to share out the chat transcript, and then you should see us coming in your inbox soon with resources from this presentation as well. So at the minimum, some of our slides, if not all of them, and then notice when these things are posted, the recordings are posted. So thanks for humoring my stumbling MC abilities. Does anyone have any other questions? This is a bit of an experiment for us, this series. And so I'm curious to what we could do different or better. And please tune in for the August through December presentations, which are just going to be, even better. So thank you for your interest.
Can I just quickly respond to somebody asked about asbestos in older museum construction activities? That has been a problem, but it is less so than it was, let's say, in the 1990s or something like that. What is of concern, though, is that many places they were replacing some of the benches, the lab benches that they have used, and they are replacing them with high silica dust containing materials, and that represents a significant worker hazard that we should all be aware of. But more specifically is that construction workers who put these laptops in, lab spaces in, if they are not protected, they could be at risk for acute silicosis. And that's something I was just about to put in the chat, but I wanted to respond to a prior point that had been shared with somebody. My apologies for not knowing who that was.
Maria?
Yeah, yes.
I'm sorry. Maria, this is Kathy Makos.
Hi.
And I am, first of all, you and Lauren and David have put together just I mean, it's pure gold what you've put together. I just want to say everyone here is just, it's amazing. But very quickly, so Nancy, Nash, and I are trying to find a speaker related to on-site's work for the Safety and Cultural Heritage Summit. You know, I'm on the local Potomac AIHA section, and the power of collaboration is the theme, and we are looking for, well, we would love to know if you, Lauren, and Colleen, correct, would be interested in presenting, putting in a presentation, 20 minutes or what have you, on your collaboration, because it's, as you know, it's very, very important. And as Nancy will surely attest, it's very important for people to see how important OSHA Onsite can be to your professional community everywhere. And and I think, Nancy, I'm not sure if Virginia's not quite on our museum. We have this museum project initiative through Onsite National, and I think you are on now. But anyway, you don't have to say yes, but right now, but I'd like to talk to you about it afterward. And putting an abstract in by tomorrow is not a big deal. A proposal, if you're at all interested in doing this, let's talk. I'm on the abstract review committee, so this is going to be fine.
Thank you. I'll call you after. How about that?
Please do.
Okay. Okay. Thank you for thinking of us.
Oh.
We are going to try to submit an abstract on, basically, we're going to try to develop a guide based on this stuff. So, but I'll talk to you afterwards.
Thank you.
Yeah. And thank you too for the folks for mentioning silicosis, because asbestos, silicosis, these are also threats, at least the museum industry as well. We just didn't have time to talk much about them, but in terms of objects conservation, and especially in excavations as well. So there's a lot more to talk about.
Paleontologists as well.
Yeah.
Removing fossil bones.
Yeah. Well, we've occupied everyone's attention for quite some time, so thank you guys for hanging in there. If anyone wants to unmute and ask some questions, or reach out in the interim, please feel free. I think on the registration page for this series, there is my email, so feel free to reach out. And thank you to the couple of people that shared their emails too. I will reach out to you guys too.
And this is really fabulous.
Oh, thank you.
Nancy, did I?
Colleen.
Okay.
No, I sent Colleen an email separately, but I wanted to know if the Wisconsin lab analyzed those wipe samples that you took.
Yes.
Okay, so just so everybody knows, we have a lab in Wisconsin that has a contract to analyze all of the samples for most of our consultation programs in the country. So I just wanted to verify that. Thanks, Colleen.
You're welcome. I just wanted to take a moment to say thank you, Maria, Lauren, and David, for having me on as a representative. Although I'm here representing the state of Virginia and our consultation services. Our consultation services are available. I wanted to remind our participants they are available throughout our 50 states, including many of the U.S. territories. We provide services in general hazard environmental assessments, as well as IH sampling, as Maria and David and Lauren had discussed. And if this is something that could benefit your small, medium-sized company, or if a large company has questions, definitely feel free to reach out as well. And if you're in a different country, please look in to see if similar services exist within your company also, or within your country as well. Thank you.
Thank you, Colleen. Yeah, Colleen or Nancy, do you know if any tribal communities have been clients of any of the consultation programs?
I can only speak for the state of Virginia. I'm not aware of anything within the state of Virginia, nor have I heard anything about any other states as well. But we're certainly available if they were to reach out. I would strongly encourage them we're here to support them as well.
Yeah, it's possible, Maria, that we've had some consultations in the past with the state's programs. And like Colleen said, they are available to assist the tribal communities.
And we definitely are going to use that as a question for the next joint museum working group and contamination working group discussion, because there's training and things of this sort that we're working on, different lanes together. And so I really don't understand. I really don't see why it can't be, unless there's something in the law. But you know, we should pursue that as an important resource.
And thank you everyone for joining. Yes, we could ask Gina Agron. She covers Alaska. What I would really love to do, and I shouldn't say this out loud because then I'll jinx myself, but you know, I'd like to find, you know, a willing partner in maybe a small historical museum, and then a separate partner in a tribal community, and see if we could partner up and say, hey, all right, this is the resources we found. Can we serve as partners with you to kind of offload some of this information and help guide you through exploring if it is useful, or help direct you, you know, almost like a little a free consultant. Not that, you know, we're experts, but we've gained some competency in how to navigate between these communities of health and safety and dealing with the vestiges of past use with cultural objects. So I am very interested in that.
Holly
as well.
Cusack Bay would be a perfect source. We should, we should all talk about that.
Yeah. She is presenting in August with her colleagues, and they have adapted, they've worked as well with her course with some tribal communities in the upper Midwest, if I'm remembering right. So we'll hear from her next. Yeah.
Nancy, can I ask, and maybe Colleen knows too, I understand that the Navajo Nation has its own OSHA program, if you will. They have their own OSHA type of program. The only tribal community who does. Does that make any sense to either of you? I don't know where I had read that, or someone, or maybe a tribal member told me that. So, or someone from Nash told me that, I believe. So it's interesting, because that would mean, if they're somehow connected that way, that would mean that they would be connected to on-site as well. It's just a road we can go down to explore.
Yeah.
I'm unfamiliar with that, but it is interesting to look into. I will look into that a little bit further. Thank you.
Yeah, Kath, I am not familiar with it either, but definitely worth looking into.
Oh, Mary Corrigan is. There we go. Thank you. You got it.
I didn't know that, but thank you for bringing it up, and now I can look for the right information.
Okay.
But that sounds like a great partnership.
Well, excellent. If anyone else wants to chime in, anything coming off mute, please feel free. And otherwise, we might let everyone go about their afternoons.
Just one other thing, if I may, since you brought in Holly Cusack McVeigh, she and I are going to have a poster at the International Society for Environmental Epidemiology meeting next month in Atlanta, looking at the joint exposure to coccidiomycosis and silica dust as a source for outbreaks for valley fever. And I just want you all to know that Holly has been absolutely tremendous collaborator and very strong leader in the museum field, who's trying also to knit together expertise in health and safety to go with her training in museum science. So just a shout out to Holly. And
Yes,
praise.
thank you. Yeah, no, she's pretty fantastic, and she'll be presenting in August with a colleague at Purdue, occupational and health and safety colleague at Purdue, and then a curator of a museum they've worked with. But they'll present on other case studies as well.
And what's the meeting, Maria, that she's going to be speaking at? Do you know?
So this series is 6 months long, one presentation each month, and she's doing
Okay.
the August presentation.
Got it.
Yeah.
All good.
Yeah.
Thank you.
Well, thank you everyone for joining. And thank you so much for listening and for your input as well. Because our main goal was really to make this be a forum where we could hear as much as we spoke. So thank you very much for your time and interest. And please, use this as a resource if you can. We appreciate your ideas and opinions and thoughts, and especially if you can think of ways to collaborate. So good
Thank
luck,
you,
everyone.
Maria.
Thanks so much.
Yeah.
Thank you.
Thank you. Take care.